Kim is a 25-year-old woman who comes to the emergency department with vaginal bleeding and abdominal pain. An ultrasound done when she arrived revealed she is in the process of a spontaneous abortion. She has never been pregnant before and is not currently using contraception.
Hi, Kim. How are you feeling?
I'm still having some cramping.
Okay. Well, I'm sorry to tell you this, but your ultrasound does show that you're going through a miscarriage. Is your husband or your boyfriend here?
No, I'm single. Are you saying I'm pregnant?
No, actually. I'm sorry to tell you this, but the cramping and bleeding that you're experiencing is actually your body emptying the uterus. So you're not pregnant anymore. I know that must be hard for you. Do you want to call anyone? Do you have a friend you can talk to?
I called a friend. She's on her way. I'm sorry. I didn't know I was pregnant. How far along was I?
Oh, you weren't planning a pregnancy? You must be relieved then. Actually, it's funny. In your chart, it said that you were on the pill, but now you're not on the pill, and you're not using any method. So you do know that puts you at risk for being pregnant, right?
Yeah, I went off the pill when I broke up with my boyfriend. Honestly, I wasn't planning on having sex. I just slept with a friend a few times,
Okay.
but it's been weeks since I last had sex.
Okay. Well, your chart did say that you haven't had a period for 2 months, so that probably means you're about 6 weeks along.
So what should I do?
Okay, well, one option is that you can go home and let the pregnancy expel naturally. You might have some cramping and some bleeding. It could take a few days to a few weeks. But if you have any complications like bleeding, infection, you can go see a regular doctor. And this is probably a good option for you.
I really rather this not take a few weeks. I'd prefer it to be over now.
Okay. Okay, well, there are a couple of other options. One is that we can give you a medication, and that helps your uterus expel the contents more quickly. Another option is we can do a manual vacuum aspiration right here in the emergency department, and that's probably the quickest option for you.
That sounds best to do it here.
Okay.
Oh, will that hurt?
There is some cramping and some bleeding involved in the procedure, but we will give you some numbing medicine that'll help cut the edge of the pain some. But it also only lasts 5 to 10 minutes, so that's probably a good option for you.
Okay, I think that sounds best. Can I wait until my friend gets here?
Yeah, of course. Maybe while we're waiting for your friend, we could talk about a few things you could do that would help benefit your health a little bit. You did have unprotected sex, and that does increase your risk of exposure to sexually transmitted infections, so we should probably talk about some tests we could run. Also, maybe we should talk about a contraceptive method that you could manage better.
All right.
Okay, great.